Good afternoon. I'm Dr. Paula Duren, and I'm the Director for Universal Dementia Caregivers. And we come to you on Thursdays with some discussion related to caregiving that's really important to us taking care of and supporting our loved ones living with various levels of disease or cognitive impairment, or just the aging process where they are dependent on other people for support. We have a wonderful guest today. Our guest is Tamera Perrin, and if I've mispronounced your name, let me know. And I want to welcome you. She is the Elder Abuse Prevention Coordinator for the Detroit Area Agency on Aging. And we've invited her here today because it's such an important topic, first of all. So many caregivers are caring for loved ones. And the question sometimes is, as the title of this presentation is, people will say, well, what is elder abuse? But at the end of this conversation, you will learn that it's not, it's something that's right there in your face and you're not paying attention or even see it. And there are some basic facts that I'd like to talk about before we get started, is that I found a stat, and Tamera can confirm it for me, that over 500,000 complaints are received every year, but a large majority of elder abuse complaints are never received. That people oftentimes don't report because of fear or shame or any number of things. So I want to welcome Tamera to our conversation today and say, welcome, Tamera. And can you just start out by telling us who you are and what you do briefly? And we'll get your phone number and all those things afterwards. And I'm really looking forward to a conversation with you today.
Okay, thank you. And thank you for having me. Yes, I've been the Elder Abuse Prevention Coordinator since 2017 for Detroit Area Agency on Aging. We're funded under a grant through the Area and Aging Service Prevent Grant. And because this is such a global problem, it's not just local or national, it's a global problem. Elder abuse hides in plain sight. And that is our mantra, because one of the reasons is that a lot of people are not aware of when they're actually abusing seniors. So we've done a lot of research, developing information and training kits and training manuals. And when we first started, we started 2017 working through faith-based organizations, being that faith-based organizations have seniors go to church, they have large congregations. However, when the abuse happens and seniors are, let's say, maybe traumatized or fearful, they turn to their pastors. And a lot of times pastors don't know, okay, how do I get you the resources and help? And especially if these are family members that are causing the abuse, or that, say, people are aging. A lot of people don't understand the aging process. You have some pastors who are younger, some are older, but then again, even some of the aging adults do not understand the aging process, or not made aware of it. And also, what is vulnerability? What does a vulnerable adult look like? It's not always a person that's on a walker. It could be a person who has dementia, a closed head injury, a person who is visually impaired. These are a lot of things that, or say, characteristics that happen in our society. And because it also makes people vulnerable to having to give up their independence. So therefore, let's say the first one would be being vulnerable. What is vulnerability?
Can I interrupt you just for a quick second? Let's do some foundation building. How would you first define elder abuse? And then let's build from that so that you can educate us, so that at the end of this conversation, we will know it when we see it.
Okay. So elder abuse is any types of neglect or intentional harm, and let's say intentional and unintentional neglect, abuse, abandonment, which falls under the categories of emotional, psychological, physical, sexual, self-abuse, and financial exploitation. that happens to a person that a reasonable person would not do to a person that they have responsibilities for their caregiving and assisting them in their daily living responsibilities.
Okay, so you started listing different types of abuse. One of the things that I'd like you to do is to talk about some of those. For example, physical abuse. What I came to mind for me is something that happened recently, is that there was a loved one living with dementia. The caregiver, the person that visited him was not the caregiver. His brother was his guardian and was not providing the right foods, was not keeping his house clean. Would that fit into the category of neglect for that gentleman?
Yes, that becomes neglect. That's not physical abuse. That's actually neglect and neglect and abandonment on the part of the person or the guardian who is the caregiver, not providing the necessary care or providing, say, paying for the expenses or the environment for that individual. So that would fall under neglect and self-neglect, because if the person has capacity, then that's on the individual. But if they don't have capacity and they have a caregiver, then that also falls under neglect. And it's that person neglecting to do the responsibilities that they have to provide the quality of care for the individual they're caring for.
Okay, you started talking about financial. What does financial abuse look like?
Well, financial abuse is when a person is giving that fiduciary responsibility of either being a payee or a guardian or power of attorney, and they have, let's say, responsibility for paying for their maintenance, paying the bills, utilities, coordinating the medical services for appointments, and neglecting to do those things, and also commingling the funds, by which I mean that a lot of times they are writing checks and taking that money and not using it for the individual. They're using it for themselves, or mixing that money that they have that belongs to that individual that they have, let's say, the guardianship or over. They're mixing it with their own money, and that's where the problem happens. Appointed, or just whomever is in that role, not knowing, and then not informing the person as well as what they're doing with their money.
Okay. Now you started talking about in your introduction that elder abuse can also be done by quote unquote professionals, doctors and others. What does that look like?
Well, a lot of times when people are older, especially in the 80 and 90, some people think that because of the aging process that they're going to die, so they don't get the same quality of care that they would give to a person that, say, that is newly entering into the 65, et cetera. However, what they don't understand that is still a person, and a person that has connections and a value and want to live, and those family members want them to have the same quality of care. Because there are some seniors who are very active at the age of 100, the centurions, right. And there are some that aren't. So we kind of label or stigmatize senior, or sometimes it's just be that person is just slow in responding, because kind of like a computer, they have so much data in their memory, it's taking them a while to think out the response or to respond back, or maybe they are just want to be timely in the information they provide back. So, and that's another thing, a lot of people aren't being made aware of dementia and some of the characteristics of dementia and what they need to do to not, let's say, encourage dementia before it's time, before it gets very chronic.
It's interesting you say that about dementia, because some of the folks, most of the people we service are living with dementia, and we're supporting their caregivers. And one situation we heard recently is that the family was getting the person with dementia to sign things that they were no longer capable of signing. And that clearly fits into the elder abuse category that you just described.
Right. Right, that becomes a financial exploitation. A lot of times people think just because you have dementia, well, sign over the house, sign over the deed, give me power of attorney. They're not really respecting that person because basically what they're doing is coercing that person to do, and it's a form of intimidation, especially if they that senior thinks that this is the only family member that's there, so they do it. But then again, it creates unhealthy stress, and that unhealthy stress creates depression. And it's a form of abandonment because now it's kind of like saying you have, you're voluntarily having to give up your freedom just because you're exhibiting certain characteristics or symptoms of maybe dementia, or just it could be a side effect from medication. Sometimes people don't have dementia, they have medication, and that creates a problem for them to be delayed in the response of thinking or actions. They may have arthritis, they may be losing their vision. So therefore, they call on their trusted individuals to assist them. And then sometimes the trusted individuals take advantage.
Okay. I'm not sure I can hear you.
Of.
I couldn't
So
hear you on
again,
this
that's
side, so
women,
forgive me
emotional,
for interrupting.
psychological conflict, and sexual assault. Okay. Do you hear me?
I can now. So, but what I
Okay.
found sometimes is that even though we can't hear each other, it's still live on Facebook.
Okay.
So let me ask the question. If I'm out sitting here watching this piece and I really want to be attuned to issues around elder abuse, what should I look for? What are my warning signs?
Well, the warning signs are initially when you can look at the environment. Does it look clean? And then even if it's clean, sometimes you need to look at, say, the senior. What are their characteristics are they exhibiting? Do they have any types of bruises? And again, when you look at bruises, where are the bruises at? Are they afraid to talk? One of the things of intimidation is when someone is always there with the senior and speaking for them, rather than allowing the senior to speak for themselves. That's a form of intimidation or coercement, and where they feel afraid to speak for fear of. So, and as we stated about the medical profession, a lot of times it's best that they ask them to come in by themselves, so the doctors or the dentist or the optometrist or may ask them in private, do you feel safe? There are certain questions that you need to ask the senior to see. Sometimes you need to look at their nails and their feet to see if their care is being, have they been groomed? Are they clean? Sometimes you look at the body motions. Are they rocking? Do they stop talking when someone enters into the room? There are a lot of signs. There's so many things that you have to look for and be observant. Do they feel comfortable in having a conversation? Because as I stated, sometimes it's a family member or the trusted individuals who are there, and they don't want to speak in that arena with that person present because of fear of, say, embarrassment, shame, or that person will leave them or abuse them after the person that's asking the questions leave.
Just a question on that. Often, as you indicated, sometimes they're not comfortable speaking up. And it sounds like some of that's out of fear. Some of it might be out of shame. Do you have any strategies that you could tell us about how we might encourage people to speak up?
Well, yes, you can add, there are certain questions you may ask. How are you feeling today? Do you feel safe? Are you happy? What have you been doing lately? Do you know where your area agency is located, or have you talked to anyone? Have you eaten? There's certain things that you can, certain questions you may ask surrounding the peripheral, um, say, things of daily living. Have you been out for a day? Have you been to church? Or do you belong to what type of games or things have you played lately? Or do you participate in any games? What are your social activities? Because sometimes seniors are socially isolated. How have you been feeling? Have you had any headaches, or have you taken your medication, or have you been taking too much medication? Do you wear dentures, or do you have your dentures? So certain things you can, kind of just begin to look at the person and go from maybe the head down. When's the last time you've been to the barber? Who does your hair?
Okay.
Things like this that would help them to engage in a conversation. And then you have to read between the lines. And then sometimes if they're repeating over and over the same things again, then those are some flags for you as a caregiver. They may need to be assessed to see if it's medication or dementia, because there are some characteristics that will exhibit themselves, and even in their walking, their gait, how have you eaten? Are you vegetarian, vegan? So those are some of the things that you might want to engage in conversation. Even asking, when's the last time you visited, or your family has visited or called you?
That's great. Those are very useful pieces for us to just think about. But what it feels like, it's just engaging them in conversation.
Yes.
And engaging them in conversation, they might feel more comfortable and even show some things that you hadn't even thought about. Where if someone says, and there's no cognitive decline, that they haven't eaten in a week, or you look in the refrigerator and there's nothing in there at all. Those are all kind of clues and signs. You become a great detective because you care for that person and want to make sure they're not being abused.
And then again, you can look in the refrigerator and see, is it clean? Is the refrigerator clean? The stove, the areas that they eat from. One thing that I think is important. A lot of times when people come out to say, have the conversations or an area in the living room, they really need to look at, because this gives you a clear, I should say, a much more precise evaluation of the sanitation of that environment that senior or vulnerable adult is living in.
Great. I have two more questions for you. And you don't know how much I appreciate your time. I know you're busy and everybody's gone virtual and there's so many things you have to do. So it's such a gift for you to be with us today. Tell me now, we've got a sense of what abuse is. We have a sense of what it looks like. Some of the signs we might be paying attention to. Is there a way to prevent it if we're seeing it and we're not the one doing it? Is there some prevention strategies?
There are a lot of prevention strategies. Education and training is key. When we know better, we can do better. But then again, we have to be aware that we do have literacy issues. So therefore, it's good for people to watch movies, to look at videos, PowerPoints, to have, let's say, little coffee and conversation talk groups where they can talk about it. And knowing that it's okay to report. A lot of people are afraid to report because they think that they're going to be flagged out, that they're the ones who told. And so they need to know that they can request to remain anonymous. However, we do have the mandated reporters, who are anyone who's in the human service field, education, providing health, and who are seniors and vulnerable adult population. But prevention is truly about caring for another person and having a regard and a respect for them and their quality of life as a senior, knowing that they still have the breath of life in them and that they're still entitled to be treated as a person with dignity and respect, and that They don't want to be pushed or coerced because every day seniors deal with loss. They are grieving. They're losing friends. They're losing, especially now with this COVID-19, uh, the social isolation, this disconnect from, say, they're dealing with grief and grieving, hair loss, vision loss, mobility, income, and then their circle of friends is dwindling.
Right.
So, and then especially this loss of independence, not being able to drive, not to be able to be dependent on other people for certain needs. So that it increases the level of grief uh, very much. So in the prevention, it's looking at learning what are the signs, what are the things to look for, and because the categories in each category, there are so many things to identify and to look for. I would just recommend do come to our website so you can see it, or call us. We'll tell you, because it would take up a lot of the time that you have, say allotted right here.
Why don't you tell us what the website is right now so that we can make sure that people that are listening can write it down?
Okay, it is Detroit Area Agency on Aging, the Senior Solution, www.detroitseniorsolution.org. And our phone number is 313-446-4444. And my extension is extension 5259. And senior.
Let me ask the question of you. You gave me a sense of how to prevent. You mentioned reporting. What do I need to do? I'm worried that someone is not being given, they fit into one of those categories you talked about. And I really believe, just like you, that everyone, especially our loved ones that are older, have deserved respect and honor. How do I report my concern? And should I be worried? I know you said it could be anonymous, but they're gonna blame me anyway. So just tell us, how do we report what we see as elder abuse?
You call the Adult Protective Services at 1-855-444-3911. You can, if you're a caregiver, we also have our caregiver coordinator at Detroit Area Agency on Aging. You reach out for information and we will provide you with the resources and the information that you need. If you're afraid to call Adult Protective Services for fear of reprobation or whatever, then call our area agency and we'll report for you. But that is one of the major problems of underreporting. They can also go online to the Attorney General's Elder Abuse Task Force for questions. We have a long-term care ombudsman. So all of these numbers are available to people to call through our area agency, and also call Adult Protective Services direct. And we will provide you with the information, the resources to help that person or that caregiver, so that they will know what is abuse, what does it look like. We also have information to YouTube videos that they can see and watch or listen to assist them in that process of being more informed, so that they are not committing these types of abuses to our seniors and vulnerable adult population.
Tamera, you mentioned before we close our conversation that training was really important, and I happen to agree with you. One of the things we do at Universal Dementia is we provide training to caregivers, helping them understand many of the things you talked about, but the importance of the role, because the role of being a caregiver is stressful. And it's so stressful that sometimes you just get tired. And we recommend that sometimes you need a break. Sometimes you need a buddy that you can tap. Sometimes you need to just get out of there for a moment. You've got to put strategies around self-care. And then your organization also provides training for caregivers. I know that the Henry Ford Health Systems Care Program provides opportunities for training for caregivers. I just want to re-emphasize the importance of caring and getting some training, which is what you focused on in one of your statements.
Yes, because training, we offer training for everyone, especially for a community or say community leaders, faith-based organization, law enforcement chaplains, and financial institutions. We offer training to train people to be aware so that they can also provide education awareness, service coordinators. We also have for intergenerational, we're trying to reach out to the students in the high schools, the community colleges and the universities, especially those students who are going into social work and gerontology, so that we can provide them training on education awareness of what elder abuse looks like, so that they can be aware and help to prevent it. And for the people who are caregivers as well, we have a caregiver toolkit, we have an elder abuse toolkit, and then we have a very comprehensive training manual, because some people have never done trainings before. So we have broken it down to teach them how to facilitate, communicate. We have areas in about reporting, about the aging process, and intervention, fiduciary, and we continue to expand on those things as research brings us more new information.
Okay.
And the training is free.
I hope I didn't cut you off because what's happened is we've seen that this is still playing on Facebook, even though we may or may not be able to hear each other. But I want to tell you thank you. You are a true gift, and you have so much knowledge in this area that I appreciate it. If people wanted to call you specifically, would that be okay? And if that is okay, what number would you give them?
They would call 313-446-4444, extension 5259, or just
Okay.
Detroit Area Agency on Aging.
Okay, and also if any of the viewers are interested, Universal Dementia will always refer you to the right people. Feel free to give us a call at 248-509-4357, because if we can't provide the support, the beauty of us working together as organizations is that someone in our circle can provide you with the kind of support and care. If you are a person caregiving and you're concerned that someone's not being treated properly, please give us a call or give Tamera a call. If indeed you're concerned that you're getting too stressed, and I had one caregiver told me she's under me constantly, I need a break. Well, that's the kind of person I need to talk to. Give us a call, and please know we are here to support you. We don't exist unless you contact us and us trying to contact you on how we can help you. Again, Tamera, let me say thank you. And I look forward to having many more conversations with you. And I want to tell so if you want to say anything, last comments, feel free. Otherwise, we're going to say thank you.
Well, I want to say thank you for having me. And I want to say to the viewing audience that you are the eyes, the ears, and the mouths for those people who cannot speak up for themselves. Remember, elder abuse hides in plain sight because we're not being made formally aware of what it looks like, and because it goes underreported. So we want you to be able to recognize it. So when you see it, you can report it and we can stop it. Thank you.
So let me close this conversation by saying elder abuse is wrong. Our loved ones deserve to be cared for with dignity, with respect, and honor. And please, if you see it, report it. But as Tamera told us, oftentimes it's right there in plain sight and we're not seeing it ourselves. Please pay attention. Tamera, thank you very much. We'll talk to you again soon.
Thank you, Dr. Duren. Thank you for having me.